I'm Dr. Joe Moyer with the Allergy, Asthma and Sinus Center, and on behalf of our physicians, nurses, and staff here at the Allergy, Asthma and Sinus Center, we'd like to welcome you to our website. If you're already a patient of our practice, I'd like to thank you for entrusting your allergy care to us. The first part of this discussion is going to deal with what exactly an allergy is and then how we treat it. Most people believe that an allergy is a defect of the immune system. It is, in fact, a disease process that is mediated by the immune system, but it's actually an overreaction of the immune system. About 20% of our population has what we call allergy genes or allergy-prone genes. And those individuals make certain antibodies in their immune system which cause allergic reactions. That antibody is called the IgE antibody. And the tests that you get for allergies, whether they be blood tests or skin tests, measure the level of IgE in your system. Two specific allergens, be they pollen, mold, animal danders, dust mite, those types of things that cause allergic reactions. You can also be tested for food allergies. We're going to focus here mostly on what we call the inhalant allergies, the things that cause hay fever and asthma. As you know, if you're watching this video, you either have allergies or suspect you have allergies. Allergy symptoms primarily affect the respiratory tract. And people who have allergic or inhalant allergies have symptoms like runny nose, nasal congestion, sneezing, itchy, watery eyes, and sometimes asthma or wheezing. It can occur all year round. It can occur just during pollen seasons, which is very common. Or you may have both. You may have symptoms all year round and get worse during the pollen seasons when all that yellow dust is out there and people are sneezing their heads off. The tests for allergies can be done in one of two ways. We can either check for that IgE or allergic antibody in your serum by a blood test, or we can do skin tests to specific allergens to see what you're allergic to. If you're watching this video, you either suspect you have allergies or you've already been told you have allergies based on one of those two testing methods. So now that you know that you have allergies, what do we do about it? There are basically three ways to treat an allergy. The first is avoidance of what you're allergic to. Now that's easy if you're allergic to a cat or a dog. You can simply avoid them. However, when it comes to things like pollen, mold, dust mites, it becomes more difficult to avoid those things other than maybe putting yourself in a bubble somewhere, which of course is unrealistic. So for those particular types of allergies, we have some methods which will reduce your exposure, and your physicians and nurses here at the Allergy, Asthma Sinus Center will go over those things specifically for the allergens that affect you. So if you're allergic to dust mites, we'll give you avoidance measures and things that you can do in your home to reduce dust mite exposure. If you're allergic to molds, same type of thing. If you're allergic to pollens, it becomes a little more difficult. Of course, we want to keep the windows closed during the peak pollen season, so at least you can go indoors and not experience those allergic reactions. The second way to treat it, beyond avoidance, is medications. And again, if you're watching this video, you more than likely have tried some of the common allergy medications like the antihistamines and the corticosteroid nasal sprays. There are some others that we can go over with you depending on what you're allergic to and whether or not the antihistamines are working for you. The third way to treat allergies, and probably the closest thing we have to a cure, we can't really say that it's a cure, is what we call Allergy Immunotherapy, or more commonly known as Allergy Shots. And for those of you who are considering beginning allergy shots or for whom it's been recommended, the second part of this video, I'm going to go over with you exactly how those allergy shots work and how we give them to you.